Thank you very much. Hello, good afternoon, good evening, good morning, wherever you happen to be in the world. I'm the editor of Clinical Child Psychology and Psychiatry. It was established in 1996 by a clinical colleague, Professor Brian Lask, in order to bridge a gap, to reach the parts that other journals can't reach, was the phrase that Brian used. And it was about this dichotomy between the idea of empirical research being the truth, whilst others, as Brian said, held on to a view that the only source of useful knowledge was clinical practice. So the difference between evidence-based practice and practice-based evidence. And CCPP has always been a forum for both research and clinical practice in order to think about how they can work alongside each other. So on the next slide, I have put in, and if you just click again, Sean, there should be, no, go back one. The picture's gone. That's okay, it wasn't all that good. But the point about the CCPP was to create an interdisciplinary peer-reviewed journal. And in the first 2 years of joining the journal, along with the editorial board, we rewrote our aims and objectives to try and expand from just children and adolescents to young adults. So we increased the research that we took to address emerging adults. And in addition, we tried to emphasize that it wasn't just for psychologists and psychiatrists, but was for all practitioners, all healthcare researchers, and patient support groups that were interested in clinical psychological well-being. Next slide. One of the things that I was very keen on was trying to make sure that the editorial board reflected the diversity and equity and inclusivity that we were trying to encourage within the journal. And so when I started, I went through the board and I invited those people that had been on the board for some time who hadn't participated to perhaps consider retiring, and replaced those positions with people who represented greater diversity. And so you can see that currently we have a 9:6 gender ratio, that we have 3 people of color on the board. We have 2 people who are part of the LGBTQ+ community who self-identify as being within that community. That we, at the moment, we're not great. We're kind of very UK based, very UK centric. But when we were first started, it was very much a non-international journal, and so we started inviting people from North America, and recently we've included somebody from India. And professional-wise, we have a mix of psychiatrists, psychologists, family medicine, pediatric, and adolescent health specialists. We're missing social work at the moment, and it would be good to increase our LMIC representation. On the next slide, this is really how we approached the issue. We started including DEI discussions in all of our board meetings. So our board meetings have small breakout room conversations with a topic for development, and we've included DEI in the last 3 years. Each of the initiatives that are created as a result of these conversations are reviewed and developed. We have also taken advantage of the plain language summary initiative that SAGE has introduced. We're still getting our head around that, but it's come in. Some of the plain language summaries are quite funny. They're basically the abstracts rewritten with different headings, but we're going to work on that. We're also using the SAGE free trial of English language editorial support. So where we find papers that have been submitted where English is not the first language of the authors, we ask reviewers to review for the science and we then encourage the authors to use the free editorial support to have their papers rewritten, and then we also include the revisions. We're just I've just started using the Web of Science recommendations for reviewers, which is very helpful because that produces a list of people that have published in the area or who have reviewed in the area, and I'm able to, well, again, use a proxy of location or name. Sometimes it's a bit of guesswork, but I try to avoid who is very clearly not particularly representative of diversity. And we're also encouraging, and this is something that came out of our board meeting discussions, we're also encouraging people that are invited to review to ask less senior colleagues to review with support. So we're including less of the old boys, I guess you would say. We're trying to get away from that real old boys club that really has existed in the past. With the last two slides, for those people who are watching, who may prefer their information visually, this is a view of where the majority of our reviewers have come from in the last 18 months. And you can see that we're still very UK, North American heavy, with 66%, 70%, sorry, coming from the UK, Northern Ireland, North America, and Canada. However, the other way of understanding this is that 30% are coming from other places in the world. And this is really just our first 18 months worth of initiatives. And we're starting to get reviewers from South America, from South Africa, North Africa, South Africa, Kenya, Nigeria, China, India and Australia, Indonesia, New Zealand. So we're just beginning to pick up reviewers, and we're making and I think one of the other speakers mentioned the fact that when you started to get reviewers, you started to get papers in, and that's certainly true. For those of you that prefer their info in a table, the last slide just shows you the percentage change from 2022-23, which is the third column down, compared to this year, 23-24. And we're slowly beginning to increase the numbers from Middle East, North Africa. You can see that we've increased the number of countries that we've got reviewers from. The same is true from Southeast Asia. We've increased countries, and we're maintaining and increasing at the same time.